We truly recognize that the opioid crisis is multifaceted. You need to implement a range of different strategies in order to adequately respond to this complex problem.
It's only going to be when all the human services industries come together that we work together and try to develop some solutions to deal with this crisis.
And we have to figure out, okay, who can do what and how can we serve the public the best way we can.
Durham Region Health Department, along with 15 community agencies, are working together to implement an opioid response plan for Durham Region.
The region is spearheading an opioid task force. The amount of services and resources that we can send people to now is increased.
And currently there are 2 members from Wajigayan that sit on the Durham Region Opioid Task Force, which is really great because this ensures that the voices of Indigenous people are included in any planning, any strategies that are being developed.
We've put more harm reduction workers on the streets. We've opened our doors further through more staff for addictions treatment. We've established rapid access addiction medicine services. For every dollar that you typically invest into mental health and addiction services, there's a positive offset of about 6 to 7 other dollars in savings. And there's savings in the healthcare system, savings in the education system.
The more we have these services around, that's one more life. That's one more family, one more friend that doesn't have to go through the pain of going through another funeral for a fentanyl overdose.
Opiate addiction and substance misuse disorder needs to be treated like a community health problem, not like a segregated group of degenerates.
Everyone is affected by this, and by virtue of that, everyone should be involved in arriving at a solution.
I think that having people like me who have been through a similar experience to help guide people along in the beginning, early stages.
To get that feeling back that I hadn't had in a long time that someone actually believed in me was one of the most powerful tools in my beginning to get the momentum to get off methadone.
So it's important that persons like myself as a police officer, paramedics, emergency service workers, firefighters, hospital personnel, that we're treating people with compassion, with empathy, and letting them know there's no judgment. Addiction is an illness, and sometimes people can't help that.
This is part of who I am. That's why I don't feel embarrassed talking about it, or because I also know that I have a unique knowledge base that you can't go to school for.
What we're doing here today is so important because when people can actually see someone and feel like they can connect and relate to them is when they can have empathy, and empathy is key.